Healthcare's workforce challenges demand innovative solutions that put nurses at the center of care delivery. Our next guest, Larry Adams, brings nearly 30 years of experience from bedside nurse to healthcare executive as he leads workforce innovation at CareRev. With a deep understanding of the clinical front lines, Larry is revolutionizing healthcare staffing through a tech-driven platform that connects facilities with vetted local healthcare professionals. As Chief Nurse Executive and SVP of Strategy, he champions flexible workforce models that address critical staffing shortages while reducing labor costs. Larry's nurse-first approach is transforming how healthcare organizations adapt to the needs of 5 generations of nursing professionals. Join us to discover how CareRev's nurse-founded, nurse-led solutions are creating resilient workforces built for the future of healthcare. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us. Hi, Larry. A big welcome to our podcast. I'm so excited to have you on today.
Hey, Mike. Thanks for having me.
Well, given your nearly 30-year journey from bedside nurse to healthcare executive and your pioneering work in developing innovative workforce solutions for healthcare organizations nationwide, I'm honored to have this important conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and X in order to further the conversations occurring on this podcast. All right, Larry, it's almost time for our community to learn how you and the CareRev team are revolutionizing healthcare workforce solutions through your tech-driven platform that connects facilities with vetted local healthcare professionals to address staffing shortages and reduce labor costs. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Yeah, and I think if we're going to reimagine the health of the world, we have to put the nurses at the center of the healthcare ecosystem. Nurses is the largest labor community providing care to the loved ones that we have, to our family members, and everyone across the nation. And they should be the core at everything that we do and confined into the healthcare system.
Well, you just made conversation at my dinner table a lot easier tonight, Larry, because I am married to a nurse. I know exactly what you're talking about, and I am also fortunate to call you a personal friend. I know how passionate you are about this subject matter, but joking aside, you're absolutely spot on. If you really think about what keeps the engine moving, what keeps us moving as forward as an industry in regards to caregiving and taking care of the patients this industry is so honored to be able to serve, it's the nurse, period, full stop. And Larry, have you always had this passion? We're going to talk a bit on the other side of the commercial break, but you've always had this passion. You were that bedside nurse before becoming a senior executive at a healthcare technology company that is CareRev. Have you always carried this passion and always known and always had that rally cry for the nurse? Hey, folks, you got to pay attention to this group. These are the folks that are keeping our industry moving.
Yeah, I always have. I've always put the nurses at the center of everything I've done throughout my entire career. I knew that nurses were the backbone of the healthcare community. We were there day in and day out, serving, providing holistic care to our patients. And also on the flip side of that, we've always struggled with work-life balance. And that's what's really drawn me to the space that I'm in now around technology, connecting healthcare professionals, nurses, CNAs, whatever that provider or professional may be, into our community, keeping them into community and keeping that, what I like to call that fire lit in them as well, too, just to continue with their passion, which is providing quality care.
Well, there's no better time than now to continue to push that forward. We are at a moment in time in this industry where they are needed now more than ever. We're going to discuss in just a moment how you are helping lead the efforts at CareRev and all the wonderful things you guys are doing to help continue to push forward the solutions needed to bring to bear these incredible folks, the nurses, the CNAs, and others that you just mentioned, in order to keep our industry moving forward. It is a moment in time where folks like you are needed now more than ever. We're going to unpack all of that and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we are back with Larry Adams, Chief Nurse Executive and SVP of Strategy at CareRev. Larry, thank you so much. You set the stage perfectly on the front end of this podcast. Let's talk about the wonderful work on how you and the CareRev team are helping to power and empower the nurse at this incredibly important time in our industry. Larry, of course, this all didn't happen overnight. I have been able to personally watch your journey over the past number of years, but your journey goes well beyond just the past number of years. You have been a consummate and consistent leader in our space, but all of that started at the bedside. You are that nurse that has been there, has done that, has taken care of patients with your own hands, and now you are helping lead some of the efforts that are most needed right now to continue to help power and empower our nurses across the nation. Larry, give us a little bit of the backdrop of how this all came to be, of you becoming a senior executive at one of our industry-leading tech companies for the kind of workforce solution space. And then, of course, got to talk a little bit about who is CareRev, what's all the good trouble you and the team are causing today. And then, of course, we'll pull the crystal ball off the shelf, look a little future state, what you and the team are seeing that we as rallied around this podcast need to be thinking about. And then, of course, we can't let you out of here until we figure out how we can be helping you and your journey at CareRev. But before we get into all of that, Larry, take us behind the scenes, take us back in time a bit. How'd this all come to be, Mr. Larry Adams, RN?
Yeah, so it started early. Mike, I knew I needed to be in the nursing career when my father was ill as a senior in high school. I think all nurses go into the healthcare field for some reason, and that was my reason. But it was also solidified as well, too, with my first daughter as she was ill as an infant. So again, it's these milestones in our personal lives that solidify that we're in the right space. However, sometimes I feel like we get in a rut. I got into a rut. I spent many years at the facility where I was a secretary all the way up to the C-suite. However, in order to make meaningful change, I went back to my roots. And I went back to the bedside after many years. I was given the opportunity so I could learn firsthand of the experiences that these nurses were faced with. How can I learn better? How can I be a better leader with staffing shortages, burnout, consistency on how do we adapt to patients' care and demands? And that whole perspective, and I hope I'm showing through on this podcast, is what drives me and what makes me so passionate about workforce innovation. I think I understand firsthand what clinicians want, and we listen to them, and they want control over their schedules without compromising patient care at the most and at the forefront. And I think that's something here at CareRev that we do, and we do that extremely well. We are a technology-driven company that connects healthcare professionals to acute care facilities. We are a nurse-found, nurse-led company that puts nurses first. We are a joint commission accredited organization that believes in quality over quantity when it comes to patient care. We want to make sure that our staff of nurses, which is about 20% of the CareRev employees, are nurses. We vet these individuals before we put them to work. We give them situational based scenarios So we know when we put them at the bedside that they are going to give the utmost quality care that anyone in our industry would want to receive.
Absolutely wonderful. And thank you for setting the stage on that, Larry. And of course, you mentioned a bit of who CareRev is and how you guys are going about your business and continuing to help innovate and improve our industry. But, one point I think that was incredibly important, you mentioned CareRev is nurse found and nurse led. I think that's incredibly important because until you've walked in those shoes, how are you to walk into those boardrooms and into those C-suites and try to enact change without really knowing where those folks are coming from? Larry, how important has that been when you're working with your colleagues and peers, these executives at health systems making massive decisions that, of course, not only impact their organization itself, but the communities that they serve? How important has it been having nurse leadership, just like yourself as the chief nurse executive at CareRev? How important has that been to help serve your customers?
Mike, it's been instrumental to me. Just being at the board table, having a seat in the C suite. If your nurses at your facility are not in decision making capacities, you will be left behind. You have to have a nurse to sit in and talk about what nurses do. However, one of the other most important pieces is you have to bring those nurses that are doing the work into the work. They have to be a part of it because they are the ones living, breathing, and executing on everything every single day to keep our community safe whenever they go into the walls of the hospital. And again, it's just to the utmost important that we do that. Mike, you and I have worked together here in the past. We're great friends, and nurses speak nurse. And when you have a nurse at the table, you can speak nurse, and that goes just leaps and bounds, and it just kind of propels you to where you need to be because nurses know nurses. Nurses encourage nurses to do and be better. And I think that's where we have to be as a healthcare community.
Well, again, let me double down on it. Being married to one, I know exactly what you're talking about because I'm not let off the hook easy at home, that's for sure. And of course, you have had those conversations with my own family members that
Yes.
I personally cannot have because I definitely have not walked in those shoes. So I think it is incredibly important, all joking aside. But Larry, thank you for that. Let's also discuss, and we'll put a link in the episode notes for our listeners around an incredible article that you published inside of Med City News recently. And you mentioned in the article, you stated that healthcare's workforce blueprint is really out of date. And that in mentioning that in your article, again, we'll have it in the episode notes. Can you elaborate on the specific outdated practices that you and the team are seeing most frequently and their impact on healthcare delivery?
Oh, absolutely. This is, again, one of my passion things here. So the biggest issue that we are seeing is that many staffing models still rely on rigid, outdated scheduling systems or scheduling practices that don't reflect what the current workforce has as expectations. An example would be that is, why does a nurse have to work 3 12-hour shifts a week, but you got to also work every other weekend? You're giving no flexibility to them within their scheduling. So that's why some nurses are just not happy. We also have to look at some of the outdated tech that hospitals or healthcare organizations are using. Or maybe they don't even have tech at all. Maybe I speak to facilities on a daily basis that are still in Excel spreadsheets. They're still on even pen and paper. Just the other day, someone was still on pen and paper. We're in 2025. We got to give these nurse managers tools so they get out of the monotonous routine of playing phone tag to schedule and cover this shift, or we're down, the acuity's up, our census is high. So now everybody needs to do a little bit of overtime, mandating overtime. We have to break that paradigm. We have to get out of that. Health systems continually rely and depend on costly travel contracts, 13-week contracts. They lock them in, or maybe their float pool hasn't been updated and they're still living these rigid kind of policy lives. We have to leverage and move towards a more dynamic local workforce that's going to lead us to decrease on the inefficiencies and reduce higher labor costs and get rid of that staff burnout. All which, as we know, you live it at the dinner table every night, impact patient care. The time is now. We have to shift towards a more flexible, tech-enabled staffing solution.
Well, also, too, Larry, you just mentioned a little bit ago, a really important word called a dynamic environment. And I think one of the ingredients of creating that dynamism that we're experiencing, I think right now, and keep me honest here, we have the most amount of generations of nurses working in the industry than at any other time in the history of the profession. And so with that, and in the article, you also discuss the flexibility, meaning different things across generations of nurses that are in the workforce as we speak. How is CareRev's platform designed to address these varying needs while ensuring consistent quality of care that you just mentioned?
Yeah, 5 generations, Mike. We're dealing with 5 different generations of nurses currently in the work environment. Flexibility is not one size fit all. Flexibility to a new graduate may mean they want full time. They want that stability because they're building their career. While you look at the other end of the spectrum, a working parent might need flexibility because their kids or loved ones or care have baseball games, they have sporting events, they have life things that they want to accomplish while they're in that midlife, right? With their kids. And then lastly, you have the late career. The baby boomers are out there. They're ready to retire, but they also want that flexibility to maybe only work a couple times a month, 3 times a month, whatever it is to keep up that license that we work so hard to do. At CareRev, the platform allows just for that. It allows the professional to choose when, where, and how often they want to work, but also matching to the facilities to maintain the right staffing levels as well. So we make sure that we're doing that delicate balance, but all at the same time, CareRev carries our professionals carry what I like to call a credentialing wallet. So that means they're credentialed to a certain degree with background checks, drug screens, immunizations, where they can be nimble and work at several different facilities. And maybe they just have to tailor a couple of those items to each facility, but it makes the onboarding more streamlined. We also at CareRev do performance tracking because we are Joint Commission certified. So we have to meet certain standards where we counsel our professionals if they have issues. And we try to mirror what is happening internally with our clients to what we also do with our professionals from a counseling and also from a reward standpoint. We have a lot of CareRev nurses on our platform. They get Daisy Awards. So they're out there providing that quality care. They're being recognized by these systems. And we're just super proud that they just chose CareRev to work through.
I absolutely love it. And of course, you mentioned a moment ago around this delicate balance, right, of creating this flexibility within the workforce and how important it is today. 5 generations, that's just absolutely mind blowing. But let's also talk about another delicate balance. And it's this balance between that flexibility that you just mentioned and organizational culture. You know as well as I do, you've helped to lead and been a leader inside a health system. And now, of course, at your role as the chief nurse executive at CareRev. So you see this from CareRev's perspective back into the customers that you serve. Let's talk about that delicate balance. How do you balance the need for workforce flexibility with maintaining organizational culture and team cohesion in healthcare facilities? That's a big one. And I know a lot of folks are, really toiling with that question right now because there's so many things changing so fast. I mean, how do we continue to hold on to this notion of culture that is so important that helps fuel organizations? How do you view that? How do you and the team at CareRev go about helping your partner solve for that delicate balance?
Love it. We educate as much as we can on flexibility and culture. Those two things have to be in sync and they can't be at odds, which kind of is a little different thinking if you think about it. Flexibility, culture, you got to have one or the other, but I say you have both. It's a smart integration. So when you think of it that way, you're ensuring that the per diem staff that come into your facility are feeling connected. They're feeling like family. You're teaching them your culture through strong onboarding, through strong communication, and relaying to them, this is our culture at our organizations. So the best practice that I've seen, Mike, is when hospitals that foster that collaboration between culture and flexibility, it also goes to their full-time and their flexible staff because that's when they see the best results. They're merging the two. They're treating them as one. They're treating them as the culture of the facility because we also encourage that organizations, provide that consistent training. If you're going to give it to your full-time people, you might as well give it to the per diem staff too because they're part of your system. They're part of your ecosystem. So we like to get feedback. We like to close feedback. We like to get all that because we know and we believe that is what's going to help us maintain that high quality care and that strong sense of teamwork that we want to instill in each and every care rep professional.
Well, let's get to real world examples, Larry, because that's where rubber meets the road, as you know as well as I do. Could you share a specific example of a healthcare organization that has successfully implemented CareRev solution and the tangible impact that it has had on their staffing challenges and patient care?
Yeah, would love to. The one that really comes to my mind, Mike, is a Bergen Newbridge Medical Center just outside of New York City. Bergen is in an area where there's like 7 or 8 different competitors, just a lot out there. They're like a safety net facility. So they see other challenges. They have a lot of things happening, but we went in and we partnered with Bergen Newbridge. And I'll tell you, it's been one of the best things that we did. We were able to come in, educate, teach, and allow Bergen to provide that more flexible workforce. They're bringing in local people that have buy-in to the community. We're looking at RNs, CNAs, all disciplines whenever we start looking at Bergen Newbridge, and we're helping them fill the gaps in their schedule. And the good part about it is it happens when the census goes up or acuity goes up. It ebbs and flows with what's happening inside the walls of the hospital. So they have that nimbleness so that they can post more shifts if they're seeing that high acuity. And Bergen's doing a great job of that. The other thing that Bergen has done is while using our platform, they were like, man, this is great. We're seeing all of these people download the app and coming to workforce. How do we give that to our internal staff? So Bergen actually partnered with CareRev, and we are doing what we call our RP Plus product with Bergen. It's a self-scheduling product, integrates with their scheduling system. It takes a lot of burden off of the scheduler because they're not in there trying to fill shifts by calling people, texting people. So we put our application in the hands of Bergen's per diem staff, and now they are self-scheduling through our application that integrates directly to and from their scheduling system. And I'm telling you, it has just been great results. We interviewed their scheduler the other day, and she's like, this is magic. This is magic was her words because she doesn't have to pick up the phone and call. She doesn't have to send a text out. She doesn't have to worry that this shift isn't being filled. She just posted them into the scheduling system. It magically went into the CareRev app. It magically went out to their full-time per diem staff. They picked up those shifts and then it magically fed back into her scheduling system. And she said, my life just got easier. There's nothing better than that testimonial.
There is nothing better, and that's where it matters most, right? And being able to serve those health systems that are doing so much for communities across our nation. Larry, thank you for that. That's what it's all about. Give us some real quick hits. You kind of just alluded to it just now, but before we pull the proverbial crystal ball off the shelf and look a little future state, because you know as well as I do, things are continuing to change and change rapidly in this industry. We're going to go there in just a moment. But give us some of the quick hits. How does this work for the nurse? How does this work for a health system? What are those quick hits? How do folks find this technology online? Maybe some of those kind of quick tips, quick hits of how this all works in the first place.
Yeah, it all works through an application. We have apps for everything, right? So CareRev has an app. Go out to the Apple Store, Android Store, wherever you get your app. You download the app. You will go ahead and start answering the credentialing questions. We pre-vet you through that piece, and then we match you to our healthcare facilities that are posting shifts into the application. We have about 40,000 healthcare professionals on our application today. They're working, they're picking up shifts across 35 states in the country. We're over 70 plus healthcare facilities across the country. So it's just the way that the world is going. is through these applications, connecting them, but we're just making it easy. That's the key. You make it easy, you make it flexible, and you make it so that the healthcare professionals want to come and work at CareRef.
And for the health system providers out there that are in our communities across the nation, how do they get their hands on the technology? Do they just pick up the phone and call Larry Adams? What do they do? How do they get a hold of you guys?
Mike, I think everybody has my cell phone, but if they don't, reach out to me. I feel like it. But no, yeah, I'm on LinkedIn. Reach out to me. It's Larry Adams. I went in and all you have to do is type that in. I'm Larry Adams. You'll see me out there. We have a very good LinkedIn following for that one, as well as, email me, larry.adams@carerev.com. Pretty simple. But then we also just type in CareRev in Google, carerev.com. Go out there. It'll give you a lot of good information. We have a lot of great stuff on our website, but we're easy to get contacted. If not, contact Mike. He knows how to get me.
I assure you, you send a message to Larry, I assure you he will reply. There is nothing that falls through Larry's inbox, I can assure you. So,
That's right.
well, thank you for those contact points. We will reiterate those contact points towards the back end of the episode as well, but thank you for that, Larry. Let's take that crystal ball off the shelf. Things are moving so fast. You know as well as I do, you were there working in the industry prior to the pandemic. Pandemic hits our industry and, of course, just society and the globe writ large. And a lot of things were exposed and further exacerbated in regards to the inequities and efficiencies and deficiencies of our industry. And as a result, on this side, if we call it on this side of the pandemic, things are only continuing to accelerate in regards to change and how we go about reacting and acting to all those changes. But let's also continue to look even further out. Let's say 3 to 5, 5 to 10 years, Larry. What do you believe a truly resilient healthcare workforce model will look like? And what steps should healthcare leaders be taking now to prepare?
A resilient workforce. You have to have a resilient workforce that will be adaptable, tech-enabled, and built around clinician preferences. We'll see a shift from that rigid employment models to be more dynamic. You'll see hybrid approaches taking a more forefront with a blend of full-time staff, flexible staff, and local talent. What healthcare leaders have to do now and start now is embrace this. They have to embrace the new workforce technology. They have to begin investing in their clinician well-being. They have to start rethinking traditional staffing strategies, or they will be left behind. The future of workforce will be one that is smarter, not harder.
Very well said, Larry. And it's really simple to just, let's equate it back to our own personal lives, right? The way we've done banking, completely flipped upside down. The way we shop. I mean, you can go on and on. The way I get to the airport from my house. The way I book my entire vacation now. I don't even talk to anybody. And I do it at the comfort of my own couch with a cup of coffee and can have it done in a moment's notice, right? So we think about all these different ways that these types of technologies and applications have impacted our own personal lives. These exact type of applications and technologies that you just described are coming to healthcare. They are here. And to your point, we have to start embracing it. We still have to think about how do we continue to not only answer for today, but get ready for tomorrow, because tomorrow is quickly here now. And we have to prepare for those moments. And we have to basically serve what the marketplace desires and needs. And you just absolutely encapsulated all of that, Larry. So thank you for that. We'll throw the crystal ball back on the shelf for now. Let's get back to current state. You know as well as I do, this podcast loves to help out our guests. There is a passionate community tuning in across the globe and love to help folks out just like yourself. So Larry, what's one problem, need, or question that you and the CareRef team have that our community can be helping you with?
I think we want to hear from the community on how to solve workforce challenges. How can we be more of an innovative workforce solution? So I ask all the listeners to please help me with that question, because I think it's going to take the entire community. It's going to take the entire healthcare system to figure this out together so that we can provide what the healthcare professionals are looking for.
Easy enough. And I know you already listed them out, but just because it was right after the question to help you out, go ahead and share those contact points online again, social media handles, websites, or otherwise. Again, how do they get a hold of you, Larry?
Yeah. So again, LinkedIn, type in Larry Adams. I'm there. My LinkedIn has Larry Adams in it. So you'll get me there. Also, you can get me at Larry.Adams, SADAMS at carerev.com, or go to our carerev.com website and feel free to reach out to us.
Easy enough. And for our listening community, just simply scroll on down into the episode notes. All those contact points for Larry and the CareRev team will be there for you to go ahead and grab and get a hold of Larry. Again, I promise you, you reach out to him, you will hear back from Larry. There is no doubt.
Yes, you will.
And of course, you can head over to our free global online community at passionatepioneers.com. There will be a post for Larry's episode where you can have all of those contact points, get a hold of him that way as well. And of course, leave any comments, questions, feedback, or otherwise, again, over at passionatepioneers.com. Larry, we're almost all done and wrapped up here on the podcast. But before we sign off and let you get back to causing all that good trouble that you and the team are helping drive at CareRev, we have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
I believe the focus needs to be on nurses and the future of nursing. If the healthcare ecosystem wants it, they have to thrive instead of survive.
Absolutely love it. And way to bring it all home, Larry. Thank you so much. And of course, again, Larry, I have been waiting for quite some time to have this conversation and share your incredible journey and all the wonderful things you're doing to help continue to advance our communities and our industry all together, all at once. Larry, I am so grateful to call you a friend, a mentor, and somebody that is truly making a mark and a difference in our industry. But for now, thank you for taking the time to be with our community and sharing all the wonderful things happening in the CareRev camp. We appreciate you being here today.
Mike, thank you for having me, and I look forward to this, and I appreciate everything that you are doing for the healthcare community through your podcast, through your work, and also through your family. So thank you to your family as well.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.